We have created this training video using a format that contributes to enhanced and accelerated learning. However, we recognize some trainers will want to move freely throughout the video in order to better support their training schedules and processes. Therefore, the following time code markers are provided for the trainer who wishes to move forward or backward in the video to a specific training section.
This video covers the reset instructions for the Pyng FASTResponder training device. The FASTResponder trainer is clearly marked not for human use, and therefore is only to be used for training using either SimStern material or the chest mat, which is part of the training system. Both of these training accessories are available for purchase through your local distributor. First, let's describe the trainer. Access the trainer by removing the protective dome and removing the trainer from the packaging tube. Keep these components for storing the trainer when not in use. The trainer is identical to a clinical device with the exception of 1. The locking pin is not attached to the adhesive covering over the target foot, and this covering on the target foot is not to be removed. Because during training the target foot will be used repeatedly, the adhesive surface of the target foot should not be uncovered. 2. Another modification to the trainer is this small hole drilled into the needle cover that is used during the reset procedure. Its use will be explained in a moment. 3. The bone probe needles on the trainer are solid conical needles designed for durability and stability. The bone probes on the clinical device are hollow, beveled, and surgical steel needles. To begin, let's demonstrate the use of the trainer in a block of SimStern material. For instructions on the proper deployment of the FASTResponder, please refer to the instructional video and printed instruction materials available on the Pyng Medical website at www.pyng.com. To deploy the trainer, remove the locking pin and follow the 6-step deployment protocol of position, placement, push, pause, pull, and prepare. Position yourself relative to the SimStern. Place the trainer on the SimStern. Using 2 hands, push the device into the SimStern with user-applied force identical to that used to penetrate the cortical bone of the manubrium. Pause, removing the non-dominant hand from the handle and repositioning it to hold the target foot in place. Pull the handle back slowly, leaving behind the target foot, infusion tube, and anti-buckle. Remove the anti-buckle and set it aside. Depending on your training protocol, you can execute the final step, prepare, by hooking a dry line to the infusion tube and connecting the strain relief hook to the hook provided on the target foot, and you can cover the target foot and infusion tube with a protective dome. This completes the deployment of the FASTResponder training device into SimStern material. The final step is the removal of the infusion tube from the SimStern. Just as you would remove the infusion tube from a patient, you hold the target foot with your non-dominant hand and you grasp the infusion tube as close to the skin as possible. Pull the infusion tube straight back until the tip is dislodged. You are now ready to reset the trainer device for another deployment. Before we begin, it is important to remember you will be working in close proximity to sharps. Be extremely careful, follow the instructions accurately, and you will not accidentally stick yourself during the reset process. First, hold the trainer in your dominant hand. Using your index and middle fingers, depress the needle cover as shown until the hole in the needle cover aligns with the locking pin hole in the handle of the trainer. Invert the locking pin to keep the loop portion of it out of the way while you follow the reset steps, and place it in the hole in the handle. With the 2 holes aligned, the locking pin will now hold the needle cover in the retracted position. Carefully release pressure with your index and middle fingers, making certain the needle cover stays retracted. If it does not, then you have not aligned the 2 locking pinholes, and you will need to realign them and replace the locking pin again. With the needle cover retracted, you can now replace the infusion tube. In this example, the device is held properly, with the locking pin facing down so that the introducer needle falls away from the bone probes. This permits easy replacement of the infusion tube and the anti-buckle. This example illustrates the incorrect positioning of the device, with the locking pin facing up, causing the introducer needle to fall against the bone probes. In this position, it is very difficult to replace the infusion tube and the anti-buckle. To replace the infusion tube, hold the trainer as shown at a slight angle and with the locking pin facing down. Now, hold the infusion tube with the strain relief hook facing down. Carefully slide the connector end of the infusion tube over the introducer all the way until the tip of the introducer aligns with the tip of the infusion tube. You will also see the strain relief hook descend from the D-shaped opening at the base of the carrier assembly. Exercise caution during this step so as not to make contact with the needle ends of the bone probes. Once the infusion tube is seated, it is time to replace the anti-buckle. Hold the anti-buckle as shown, with the D-shaped portion oriented away from the bone probes. Make sure the anti-buckle is placed below the collar on the tip of the infusion tube. There are 4 small protrusions on the anti-buckle that grip the shaft of the infusion tube, holding the anti-buckle in place. It is critical these protrusions are intact in order to hold the anti-buckle in place on the infusion tube. The anti-buckle slides down the infusion tube until the D-shaped portion passes through the D-shaped hole in the carrier assembly. Next, place your index and middle finger over the end of the needle cover and apply slight pressure, sufficient to allow you to remove the locking pin. Carefully and slowly release pressure until the needle cover is fully extended. Replace the locking pin into the hole on the handle. With the locking pin in place, pick up the reset rod. Hold the trainer in your dominant hand. In your non-dominant hand, hold the reset rod. The hollow end of the reset rod is placed over the bone probes and stylus, and you slowly push the hollow end of the reset rod toward the handle with a slight even pressure. The reset rod pushes the dark blue target foot release ring back into position. The target foot release ring is properly reset when you can see it in this position at the base of the grooves in the needle cover. The next step is to replace the target foot. The target foot aligns with the handle, aligning the sternal notch indicator on the target foot with the indicators on the handle of the trainer. First, align the rib in the target foot with the groove in the needle cover. It helps to tip the entire device to the side, and while applying even force, the target foot will snap back in place. You will hear an audible plastic on plastic click. The final step is to reverse the locking pin to the original configuration. Return the trainer to its packing tube, replace the dome, and you are ready for the next deployment. Consumables for the FASTResponder training system are available through your local distributor. 1. The FASTResponder trainer device, complete with gray shipping tube. 2. The protective dome. 3. The target foot. 4. The reset rod. Color and size may vary. 5. Bag of consumables. Locking pins, anti-buckles, and infusion tubes are included. 6. The chest mat. 7. Sim stern blocks.